Elizabeth. Hi, Mrs. Morose. How
Hi,
are you
good.
today?
How are you?
Good. So my name's Megan. I'm going to be the nurse practitioner student assessing Elizabeth today. We're going to be doing a full head to toe assessment, so just let me know if anything feels uncomfortable or if you have any questions along the way, okay?
Okay.
All right. So let's get started here. I'm just going to use some hand sanitizer over here. I'm just going to first take a look at your skin, your hair right now. So looking through the hair here, I'm not seeing any infestations, any scaling. You know not to shear combs, right? Or hats, okay. Not seeing any lumps, a little bit of scaling through the hair, and that's okay. Let's see here, I'll look at the face here, eyebrows look good. I'm not seeing any sparsity of the eyelashes. Your pupils look round, they look good. White on the sclera, I'm not seeing any inflammation or redness of the conjunctiva, so we're good there. Next thing I'm going to do is just take this little light here and we're going to take a look inside the eye. I'll have you look straight ahead. It might be a little bright, but it shouldn't be anything too uncomfortable, okay? Alright, I'm going to do the same thing on the other side here. Alright, so your disc looks sharp. I'm not seeing any hemorrhaging in the lights, and I'm not seeing any nicking. So no signs of retinopathy at 12, so that's good. Alright, so next thing we're going to do, a little just run back here. So normally for a pediatric assessment, we would do a head circumference test. However, due to your age, you're kind of past hydrocephalus or microcephalus. And we would also do a fontanelle check. But at your age, your fontanelles are closed, so we're not concerned about that. Next thing I'm going to do here is just check your temporal TMJ. So I'm going to go ahead and have you clench down. All right, now open your mouth and then kind of move your jaw side to side. Any popping, clicking, or pain with that? Okay, I wasn't feeling any popping or clicking, so that's good. All right, and then want to run through a vision test real quick here too. I'll have you read the smallest line that you can on here.
LTFPH.
All right, now have you cover one eye.
LTFPH.
Okay, and then same thing on the other side.
LTFPH.
Very good. All right, 20/20 vision. All right, and then one thing that we would check in younger kids too is on sunsetting eyes. This is for people who have, or this is for infants. It's a downward deviation of the eyes that we're concerned about any neurological deficits or any intracranial pressure. All right, next thing I'm going to do is take a look in your ears here. So just looking at the outside of the ears. Any pain when I pull back?
No.
But when I press down? Okay. Take a look inside here. Alright, the temporal or tympanic membrane looks gray, pearly intact, and your ear canal looks pink. And then same thing on the other side here. Your tympanic membrane looks gray, pearly, and intact, okay? Alright. And then I'm going to do a little bit of a hearing test on you too, okay? So I'll have you stand up. I'm going to whisper a couple words over your shoulder and then you tell me what you hear, okay?
Okay.
Okay.
FPJ178.
Yep.
AFB567.
Okay, very good. Alright. And then next thing I'm going to do here is just move on to the nose. You said you might have a little bit of seasonal allergies, right?
Yeah.
Okay. I'll look inside the nose here. Alright. Not seeing any swelling of the nose. I'm not seeing any polyps either. And then your septum looks midline, no deviations either. Sometimes in infants too, their sinuses aren't fully developed, but at your age, they're pretty much developed. So I'm just going to palpate here. Any pain or pressure with this?
Nope.
Okay, very good. All right, next thing I'm going to do is take a look inside the mouth. I'll have have you stick out your tongue here. All the way, say ah. Okay, uvula looks midline. Keep saying ah. Alright, and then, do we have tonsils? Yeah? Alright, and then I'm going to take a look at your teeth here. Okay, good dentition. So their palate looks good, uvula looks midline, and I didn't see any, you actually have really small tonsils.
Really?
Yes. But didn't see any exudate or swelling of those. Alright, and then sometimes in younger kids too, we want to check for a gag reflex, just to concern for things like cerebral palsy and neurological development, but at your age, we're not concerned about those reflex testing. Next thing I'm going to do is just take a look at your neck here, so just looking to make sure your trachea is midline, just going to palpate here. Alright, and then I'm going to go ahead and test your thyroid here too, okay? So just going to kind of move this around here. And then, very good. And then same thing on the other side. Alright, very good. I'm not feeling any enlargement of the thyroid. Alright, and then next thing we're going to do here is, well, next exam would be like what we call the breast exam or the tanner's exam. However, for today's video, we don't need to do that. So normally at your age group, you would be at a Tanner stage 3. So next thing I want to do is the respiratory system. So just going to take a listen to your lungs, and then we'll listen to your heart, okay?
Okay.
All right, so I'll have you take a couple big deep breaths for me. And then normally we would do this on skin to skin or bell to skin, but for this exam, we're not going to do that. Go ahead and take some big deep breaths. All right, and I'm actually just going to listen to your heart here while we're here, okay? All right, I'll have you kind of turn around here. We'll listen to the back side. Have you take some nice big deep breaths. All right, very good. No wheezing, your breath sound clear. No rhonchi or anything like that. Then I'll actually have you lay flat. I'm going to listen to your heart while you lay down too, okay? And then we're going to listen with that bell, okay? All right. Next thing I want to listen to is your abdomen. So I'll have you just kind of move your shirt up a little bit here too, okay? When I look at your abdomen, it's pretty symmetric. You don't have any abdominal surgeries that you've ever had done before. Okay. Take a listen here. bowel sounds sound normal. I'm going to go ahead and percuss the abdomen and kind of palpate it too, okay? It's okay. And then I'm just going to palpate. Any pain at all with this? Okay, we'll do a little bit deeper. Any pain with this? All right, and then I'm going to go ahead and take a feel for your pulses too, okay? So just your carotids. And then your brachial. And then we would do femoral and popliteal, but we won't do that. And then we'll do your dorsals. Okay, very good. Everything sounds good, +2 pulses, and you didn't have any abnormal bowel sounds or pain or tenderness when I palpated, so all good things. Next thing I'll have you do is I'll have you stand up for me, and then I'll have you kind of bend forward. I'm just going to take a look at your spine, and then just making sure your spine is midline here, looking for any signs of like scoliosis or deviation of it, okay? I don't see anything. All right, I'll have you walk straight for me and then backwards. All right, very good. And then I'll have you, let's see, we'll have you squat. Okay, any pain or dizziness with that? Okay, you can go ahead and get back up. And then we'll test kind of just your upper body strength here too, okay? So I'll have you kind of move your arms out. Press up against me, and then down. All right, and then I'll have you do this. Push against me, and then out. Very good. And we'll check your knees also, so I'll have you sit down. I'll have you kick your legs out, and then pull back. And then push your feet down like a gas pedal, and then up towards me. Okay, very good. You have 5 out of 5 strengths. And then we'll move to, majority of your cranial nerves were intact as we did the upper body assessment. I'll just have you kind of shrug your shoulders for me. Go ahead and puff out your cheeks, and then raise your eyebrows, and then stick out your tongue. Good. All right. And then I'll have you touch your finger to your nose. And then knee to shin, I'll have you move your shin or your ankle down your shin. All right, very good. Same thing on the other side. All right, good coordination. We'll do a reflex test here. So I'll have you kind of sit to the side. Okay, +2 reflexes there. All right, and that kind of wraps that up. Any questions at all? All right, very good. I'll see you guys next year.
Thank you.
Of course.